what we want to do when we're doing joint mobs of the back, this is called a posterior to anterior force along the transverse processes. I can sink down and I can mobilize each segment. I can find a segment that's really tight and I stay there. Now the question came up earlier, how many do you do? Well, as many as you need to. Maybe it loosens up after 5. So, and then you move on, okay? But what really gently by doing this can help relieve some of the tension in the erector spinae that a lot of patients get the muscle guarding. So just doing this, sometimes I'll kind of rub my hand just to get the patient used to my touch, have them calm a little bit, and then I may sink down past the erector spinae and do a little push. You okay? Okay. So this is just P to A. You're gonna probably see in your clinicals a whole bunch of other fancier, more advanced ways, but what we're teaching you here is really the entry level. Once you're proficient in this, then you can start doing mobilization with movement and some rotation and things like that. But for now, this is just the entry level. Yes, Adam?
Are you providing force with just one hand or both?
Both hands, yeah. If I just did one hand, that would be more rotational. So, so let's say that I was pushing more with this left hand. What motion would that maybe improve?
Left,
Yeah, left rotation. Yeah. Okay, so we can go from the lumbar spine all the way up. When we're in the thoracic spine, we actually have to change our orientation because this, when you look at the models, the spinous processes are now pointed down. So if we were doing a P to A there, it's not going to feel that great. So we can actually do it in this direction, and that's going to feel better for the patient. Okay. You okay? Okay. For me, what I really like to do is just have the patient try to do some passive mobilizations on themselves where he just props up on his elbows and uses his breath and just pushes his chest forward. Those are some ways that we can get the patient, especially if the patient starts to lock up anytime you touch them, because you're going to get patients like that. So, Keen, I'm going to have you prop up just on your elbows. Oh, no, on your tummy.
On my tummy, okay,
Yeah.
cool.
On your tummy. And then I'm going to have you take an inhale and then try to push my hand away. And when you exhale, you're going to sink your chest down. So see how he's getting into thoracic extension there? So this is a nice way, especially for the patients who are at the desk and around a position, to try to get some thoracic extension there. We talked about it in class where we can have the patient against their desk and actually inhale and exhale there as well. Okay? And then I'm going to have you sit up at the edge here. And one more thing that we could do is I'm going to have you put your arms around your neck like this, elbows together. And I could just have the patient do this themselves, and then I could add overpressure. So I'm going to have you inhale, and as you exhale, you're going to just extend up, okay? Inhale, and as you exhale, you're going to extend up. So look what that does to the thoracic spine. And then relax. Elbows together. And do that again. Inhale, and as you exhale, you're going to come up. Inhale, and then exhale. He's going to come up. Now I could assist him. So inhale, exhale, and as he exhales, I can push him a little bit. How do you feel? He said she's but it feels good, right? Yeah, so you can relax. Right? So the ones that you can practice all of them, but I think the big ones to really practice are going to be the long leg traction and the P to A glides. Okay, the rest are going to be just bonus to add into your patient cases, okay? And then maybe practice your stretches of the neck. All right, go ahead and practice, and then we're going to get on to orthotics.